Hello guys, I hope you're well. So today we're going through Clarithromycin. And Clarithromycin is a macrolide, and it's a macrolide which is used for otitis media, so middle ear infection. And an important point is that the treatment duration for antibiotics generally is 5 to 7 days. So a prime example of that would be like nitrofurantoin, for example, which is given 3 days generally, depends on if they're a male or if they're pregnant or not. So in children with renal impairment, if the eGFR is less than 30, we prescribe half the normal dose of clarithromycin. In adults, we would prescribe 250 milligrams twice daily, increased in severe infections to 500 milligrams twice daily. In adults with renal impairment, if the eGFR is less than 30, we prescribe half the normal dose of clarithromycin. And that's a very important point. So do not prescribe macrolides to people that take other medication, such as those that can prolong the QT interval. Examples of that would be drugs that are used for arrhythmias. Arrhythmic drugs can prolong the QT interval as well. So giving macrolides alongside maybe quinine or one of the antiemetics which can prolong QT interval prolongation, you have to be careful. So we discussed last time that you can't give metoclopramide to Parkinson's disease, as is cautioned, and do not prescribe macrolides to people with hyperkalemia. The reason why is because there are certain medication that can increase potassium levels, and that's thanks B. So trimethoprim, heparins, ACE inhibitors, NSAIDs, spironolactone, and beta blockers, they can all increase potassium, and macrolides are the opposite. So you have clarithromycin and corticosteroids, which can also decrease potassium levels, which is important. So when you have decreased or increased potassium, you have arrhythmias. So if you have severe hyperkalemia, you can get torsades de pointes, which is when you have a very severe decrease of potassium suddenly. And be careful of drugs that are CYP inhibitors, such as 2 antis, so antifungals, antibiotics, so macrolides, isoniazid, fluconazole, ketoconazole. These can all inhibit the CYP enzyme system, and this would affect medications like statins, because any medication that's metabolized by the CYP system, if you have another drug that blocks it, you're going to have an increase in serum plasma levels in the blood as well, which will lead to toxicity, right? So using colchicine as well, risk of colchicine toxicity, particularly in the elderly or those with renal insufficiency. Thank you.